Good question, Bern. Oh, that's
Yeah.
perfect. That's exactly what I was gonna ask
Okay.
you. All right. Welcome, everyone. We're going to get started this evening. Thanks for joining us for the last formal telehealth initiative webinar. This is going to focus on evaluating success following the implementation and use of telehealth, as well as next steps as we move into 2021. Just a few housekeeping items to get started with. The webinar will be recorded, as the others have been in the past. We'll also be leaving time for questions, and we ask that you use the chat function for those. Members of the team here will be keeping an eye out for both questions related to any tech issues, as well as questions on the content throughout the presentation. So I think most of you know us. Just wanted to do a quick reintroduction of the Telehealth Initiative core team. You'll hear from each of us at some point this evening during the program, but I think I can speak on behalf of us all to just really say thank you for being a part of this initiative. Look forward to continuing to provide resources and support to build sustainable virtual care programs for this group and beyond into the future. So for our agenda today, as I mentioned, we'll focus on evaluating success and what's to come. Since the telehealth implementation playbook has really served as a framework for this program, we'll start by wrapping up some of the final steps as part of that playbook, which include measuring success and really thinking about scaling. And then we'll also hear from a practice from each of the states on their best practices and key tips learned since starting to use telehealth, as well as what they have and what they're planning for 2021 related to virtual care. And then we'll wrap up with a special thank you and some next steps for collaboration across this group. Florida Medical Association is providing one AMA PRA Category 1 CME credit for participation in this live session. And you'll see here in terms of our CME objectives for today's presentation, being able to evaluate your practice's telehealth program to determine feasibility for growth and expansion, as well as incorporate the experiences, highlights, and best practices of telehealth implementations as part of the telehealth initiative. All right. So just to kind of jump in here in terms of evaluating success, many of you have been using telehealth for at least the last 8 or 9 months or so, if not longer. And had we, really gone through this process as planned, we probably would have started a lot earlier thinking about this concept of defining measures of success. With that said, still really important with any new initiative or implementation that you measure and assess what's working, especially if considering kind of an expansion to different patient populations, maybe additional clinicians within your practice that are interested in leveraging telehealth or virtual care, as well as integration with additional digital tools. So that really helps kind of identify where tweaks on execution may be helpful as you kind of plan for that future. If you haven't started to take a deeper look at the impact of telehealth on your practice or have had kind of formal metrics around it, now might be a really good time to start assessing how things are working as we kind of kick off a new year in terms of 2021. So each of you and your practices may have had different reasons for initially kind of signing up to participate in the telehealth initiative. A different reason, a different strategy, a different why, which really can lead to varying metrics of success depending on what that why is. This slide just shows a few of the suggested example metrics that we've heard from different practices across the industry, health systems, small, medium-sized, large physician practices, and how they're really thinking about how they'll measure the success of their telehealth program. And we've really taken this as a framework to think about it in the construct of the quadruple aim. Of course, you'll see some of those standard metrics here like revenue and reimbursement, which we know is really important, visit volume, both physician and patient satisfaction, no-show rates is something we hear a lot, but you'll also see outcomes in terms of health outcomes, continuity of care, maybe compliance with standards of care, or increased patient engagement, which I think are things sometimes that can take a little bit longer to really assess impact around. So I think it's important to maybe pick some quick wins, but also really think long-term about how you'll leverage telehealth and kind of measure those metrics that take a little bit longer to capture actual change around over time. Additionally, we really realized the importance of measuring impact this year, given the situation that we're in with COVID, and really trying to think about the things that we can do to make some of the coverage and the policy changes that really helped accelerate, the use of telehealth across the industry. How do we build that body of research that can help, really make the case for keeping those in place so that telehealth and virtual care continues to be a viable solution financially for practices. So we've actually started some research at the AMA to better understand how varying practice types, sizes, as well as those practices that are using varying practice models are actually measuring success in their environments. And we'll be developing specific case studies with different practices and organizations that will be providing some real data and insights that I think can be really helpful, not only for this group, but I think the industry overall. So that's something that is on the radar and really kind of our next step in some of this work around telehealth for early 2021. And we'll be sure to share that when it comes out. And I didn't make a specific slide on this, but it can be helpful, again, to kind of create reports in your EHR to easily track any key metrics that you decide on a regular basis. And if you haven't already, it's a really good idea to just set up some patient and even care team surveys that you can execute on a regular basis as well to really understand how telehealth and any other virtual care modalities, frankly, that you're using may be impacting your kind of key end users. So just of note, the playbook does actually provide some short surveys around both for physician and patients that can be either taken and used right there or adapted to your practice as a resource. So now we're going to get into some of the practice spotlights that I mentioned earlier, which honestly really brings this concept of evaluating success and planning for sustainability to life. So I'm going to hand it over to Shannon Vogel from Texas Medical Association to introduce our first practice.
Thank you, Stacy. For our first practice spotlight, it's my real pleasure to introduce to you Joseph Valenti Md. He is founder and co-owner of Caring for Women in Denton, Texas, and a Physician Foundation board member. So rather than going through Dr. Valenti's long list of credentials and accomplishments, I'm going to just tell you one thing that he likes to do in his spare time: work on his vintage Mercury Cougars. So Dr. Valenti, now that everyone knows what an accomplished and cool guy you are, I will pass it off to you.
Oh, thanks, Shannon. That was so kind of you. Well, first of all, for everyone on the call, thanks for spending some time with us tonight. We hope tonight will be very informative and instructive about how things are going. So Caring for Women is a practice I started in 2001. We have 3 offices, 6 physicians, 3 midwives, and a nurse practitioner, and we're actually 60 miles from the Oklahoma border. So we're a large group with a large catchment area, which became pretty important when doing telehealth, because one of the things we found out right away was telehealth allowed us to expand our catchment area and scope. So we work out of 4 different hospitals, and we use eClinicalWorks and Helo Agent to do telehealth. And we had pre-set up templates in our system for telehealth patients. Depending on who you talk to, people may call OB/GYN primary care or not, but obviously certain things in OB/GYN are not very amenable to telehealth without going into much more than that. But we did find that there were a lot of things we didn't think we could do that we did. And so we did a lot of prenatal question and answer sessions. By that, we treated a lot of UTIs. Of course, there was no sample. People could bring that in later. We treated vaginitis a lot, yeast and bacterial infections over the phone. We were able to do pre and post-operative visits, which was very nice because patients wanted to reduce their exposure and knowing they were going to be in the hospital. We did handled a lot of breastfeeding issues over telehealth. We did a lot, of course, like all of us, medical refills, medicine refills, HRT consults. We did a lot of oral contraceptive refills. We even were able to do some surgery consults if it didn't involve an exam for prolapse. So additionally, my group does a lot of genetic screening and testing. So we were able to do a lot of screening and testing that way, as well as do what we call cancer prevention planning, which is something we do with all of our genetic screening patients once we have the results. So we even were able to, over the video, go over post-operative pictures or intraoperative pictures and pathology reports. So even though we're a bit more of a specialty than perhaps most other primary care, we still were able to find a niche for telehealth in our practice. And of interest, in April, we did 1,100 visits with telehealth. Frankly, it saved us financially because we really couldn't do a whole lot when the office was closed, given the nature of what we do. Of course, we still had obstetric patients coming in and delivering and being seen. Since then, we've done about 400 more telehealth visits, and I did 2 today. So continues to be part of the practice. The biggest problem we had, I think, was patient access to internet in Texas. Up to 6% of patients in Texas have zero internet access. So that'll become obviously a national issue in different parts of different states where perhaps rural access is a problem. Additionally, we found that some of the issues were we did have some failed diagnoses or misdiagnoses, but largely those were minor in nature, and people were able to come in later. You know, if we treated a yeast, it might have been a bacterial infection and we didn't know just based on what the patient was telling us. Those things happened. But we found that one of the biggest issues for us was, and one thing we really took away from our telehealth experience early on was, patients must be prepped for a telehealth visit. And just like you're prepping charts for the next day for any other patient, you have to sit down, call the patient, have your medical assistant, make sure they have the correct setup and the correct platform, and make sure that they can access. What we found were people driving in the car doing it, which sort of worked, breaking up as they're going, but really best to have people sitting down in front of a screen, much like we're doing now, if that's at all possible. But we found the most important part of the telehealth visit to make it go smoothly was having the proper setup for the patient and making sure they were set up for success prior to the visit. So I would say overall, it's been an extremely positive experience. It really, quite honestly, saved our practice from being completely devoid of patients, especially in April and May of this year. So overall, a very positive experience. And I want to thank everyone who's been helping us get to this point, including the people at TMA and AMA and Physicians Foundation and Dr. Russell Libby, who I'm also friends with and sit on the board with. So that's kind of our take home from telehealth. And I know we're a specialty, and they said, well, it's really for primary care, but we did find a lot of niches for it. Thank you.
Thanks, Dr. Valenti. Shannon, I know you're doing Q&A. Maybe if there are any questions specifically for Dr. Valenti, we can start with those now.
We have not gotten any yet, but we welcome your questions. If anybody would like to pop some into the chat, we can share them.
Yeah, and just since we're waiting on questions, I would add that we found that about 1 in 6 telehealth visits that we set up did not go smoothly, and almost entirely related to technology and lack thereof. And really, something we really learned is we really have to pre-plan the visits. They don't work really well on the fly, and they don't work well in your car while you're driving under a bridge. So that's just something practices can take away and know that if they can set it up correctly ahead of time, it's going to be a successful visit.
That's a great point, Dr. Valenti. I have a question. In terms of like team-based care and kind of getting that visit ready to go, how do you use the different care team members in your practice to help support that?
That's a good question. We went ahead and had our chief medical assistant train all of our medical assistants on looking through the next day's patients, identifying which patients, excuse me, were going to be telehealth patients, and then contacting them, making sure we could do a little bit of a dry run on the on the connectivity, make sure they have the proper connectivity and proper platform, and that they could get on our link through a Helo agent connected to ECW, and make sure that they could connect adequately. And when that was done, almost every single visit went really well. When that was not done, it really was kind of a little bit of a coin toss about that. And, another thing is a little difficult. Some of our older patients were a little less savvy on the technical side. So we would walk them, even if they weren't really doing that well, and we'd walk them through it the day before. Our medical assistant was there during the visit, so they could always help the patient if they got disconnected or they were having a technical issue. We would just say, you know what, hold on, I'll have my medical assistant call you. We'll make sure we get connected again, and we'll get back on the call. And of course, we're avoiding all that check-in and check-out and all the other overhead expense that you're dealing with associated with having patients in the office. So even though the MA is doing that little extra work, there's a lot of other work that's not being done. So really can be quite efficient for a lot of visits. And then we're still, like I said, we're still doing them. We're very close to Oklahoma. I'm seeing a lot more patients from Oklahoma by telehealth. I had one today that was a post-operative visit and a cancer prevention plan, and it was all done over telehealth today. So very useful setup for patients, especially those living not in close proximity to offices.
Yeah, that's great insight, Dr. Valenti. We have had a couple of questions come in. Dr. Lopez asked if you could give an example of what the pre-visit prep that the MA gets done ahead of your visit. So you talked about the technology that the MA helps with. Are there other questions or prep that they go through with the patient before you get to the patient?
Yeah, so and when we check in when we have patients establish care, one of the things we want to do is get them on a remote platform so that we make sure they can access by telehealth. So that's now a new standard. We not only are you becoming a new patient, we're putting you in the system, but we're making sure you have connectivity. Or if you don't, we're documenting that in your charts, and we know you're not amenable to that sort of a relationship with us from a clinical care standpoint. So that's important. And then, as I said, just having the MA go through the list the day before and making sure that all the patients are going to be telehealth visits, that link for them is going to be optimized. So we tell them, if it's a certain part of your house you don't have connectivity, let's not do it there. If you have a choice between a cell phone and an iPad or a laptop with a camera, let's use the laptop. So there's certain things, but we still had a lot of calls over the phone, and it still worked out pretty well. I guess, the modern technology still connects pretty well, but those are some things we did that we saw helped with success with our patients.
Did it become clear to you, and this question comes from Dr. Shaw, of any insights on types of visits that should remain on telehealth and not be done in person moving forward?
So as someone who does a lot of gynecologic surgery, generally consults for surgery really need to be seen because they need to be examined. But things like a cancer prevention plan where there isn't going to be an exam and it's really counseling, I found that the counseling and the refills and even things like UTIs where I didn't really assess for flank pain or fever, but I could ask, I could even ask a spouse, just percuss their back. Are they tender? Do they jump? I was able to do those things over the phone, and I was still able to have a successful visit. But, obviously in gynecology, gynecologic surgery, there are certain things that are not amenable to it. And all those are things that are generally where you're really searching for a diagnostic answer that includes a physical exam. But a lot of our counseling and refills, those were very easy to be done by telehealth.
And one more question. You mentioned the Oklahoma patient. Do you have any challenges with trying to do telehealth across state lines in licensure issues?
I've not really had any issues along those lines. I think, our patients are coming to us from other locations, including other states, but I'm still practicing in Texas. So I've not really tried to practice outside of my state as a licensed physician elsewhere. But my understanding is in people who did do that, they had a fairly easy time of it. There were a lot of states that were amenable to making exceptions for that, especially during COVID. So I think what physicians will find is that that's a lot easier than they think it is to get that done should they want to do that.
All right, I believe we are ready. Thank you, Dr. Valenti. Excellent responses, and thank you for handling the Q&A for us. I do believe we are ready to move on to our next presenter. that I believe Bisan will be introducing. Bisan?
Good evening, everyone. I think it needs some my video. Let me see if I can get my video up, but maybe not. All right, well, there you go. Hi, good evening, everyone. My name is Bisam Biari, and I'm a Senior Practice Solution Specialist at MMS. It is also my pleasure to introduce Dr. Drummel's, let me put it back up. Where's my connection? I'm so sorry. My connection went back. Dr. Drummel Shaw, what is going on with my connection? Oh, I'm having a little second issue. Oh, right here, there you go. Dr. Shaw is a family physician and a CIO at Compass Medical, an independent provider-led organization in Southeast Massachusetts. His primary focus areas are practice transformation, mindful innovation in digital health, and physician patient experience. Very active in the AMA Innovation Network. He also leads Greater Boston chapter of Society of Physicians Entrepreneurs. Dr. Shaw, welcome.
Thank you for having me. Can you guys hear me okay?
We can.
Yep, we can hear you.
Yes.
So thank you all for having me. A quick background about Compass Medical, where I practice. We are about 6 clinical sites, 80 plus providers, and 550 team members in Southeast Massachusetts. We have 6 different locations, primarily ambulatory medicine providers. A couple of our podiatrists do surgery in the hospital. But mainly the specialty we have in-house are internal medicine, family medicine, behavioral health, a couple of cardiologists, physiatry, and podiatrists. And we have a urgent care out of 6 locations at 4 different locations. We take care of about 80,000 patient population. And before COVID, we did not do any telemedicine, but we were part of the TTI. And glad that we were. And as of now, what we do provide to our patient is tele-audio visits, tele-video, and we have recently launched a remote patient monitoring program a couple months ago. Next slide. Thank you. So some of the key highlights of the telehealth, especially since COVID, what we realize and experience is we ourselves were not fully comprehending what we are capable of. And I think for the most part, COVID really made us more resilient than we thought we were. The reason I say that is a project such as telehealth before COVID, if you had asked me last September how much time you need and resources and a budget, we had a 1-year runway and plan to go live in September of this year. But because of COVID, we ended up doing it in less than 3 weeks. So one of the key accomplishment as a team is rapid organizational development of workflow, guidance for the providers, getting the patients ready, whether it is getting the education for the patients and the community to converting all appropriate visit types into telehealth. We did all of that in less than 1 month time, which was highly stressful, nightly executive and leadership team meetings. But at the end, that is one major achievement out of this experience ourselves. And I would really want to thank AMA and Mass Medical Society and everyone who's part of TTI who gave us almost daily support and resources to get us to where we are right now. So where we are right now is back in April and March, we did 60 to 70% of our visits via telehealth, audio or video. Our volume roughly pre-COVID was around 1,000 visits a day. So between all the facilities, specialties, providers, and clinics, we roughly did 1,000 visits every day during weekdays and roughly around 300 or 400 visits over the weekend in our urgent cares. So out of all of that volume, we were doing 60 to 70% telehealth in the month of April and May. But even right now, we are about 20%. With some variation where some of the providers are doing 6 to 7%, such as podiatry, probably in less than 5% bucket. And my behavioral health team is still upwards of 70% doing telehealth. The other thing we notice is telehealth can truly help us enable the existing care management programs, some of them which we were doing it fully, and some of them we were doing it kind of in a pilot phases such as TCM. But we saw the chronic care management and transition of care management program suddenly get a huge value out of the telehealth discipline itself. We connected our nurses and care coordinators through the same telehealth platform we are using for our providers. Um, and we also launched the remote patient monitoring program this year, where we have enabled not only the nurse practitioners and providers who are part of this program through telehealth platform, but our nurses and medical assistants who are perhaps doing education for blood pressure monitoring at home. Now we show the patient proper technique via telehealth. So we don't have to worry about patient not checking the blood pressure with proper technique. And one of the newer accomplishment recently, which we have launched, is ED follow-up telehealth program, where we are targeting roughly around 300 ER discharges, which happens for us out of 80,000 population weekly. We are trying to launch at one site where we make our best effort to touch every patient who's getting out of the ED and find 50% which are probably falling into the appropriate telehealth bucket, and see if we can do a high touch care as an ER follow-up telehealth appointment, whether it is a virtual check-in for 5 minutes or a full E&M visit. The goal is to reduce the admission and downstream utilization. And the other thing we definitely all have experienced is telehealth gave us that sense of safety and access capability, which we did not have before. Because since COVID, we turned all of our waiting rooms into empty places, and we started screening every single patient coming into the buildings. And we definitely see the value of telemedicine in improving the culture of safety, especially during the pandemic. As you can see in the graph here, one of the major accomplishments we saw is existing program transition of care management. So this slide represents the volume of transition of care management visits we did before the implementation of remote telehealth services, which was somewhere around 100 visits a month. And since April, we have been consistently doing 400, 500 visits every month of ER follow-up. We have roughly around 600 hospital admission, which gets discharged from our population. And we are capturing almost 80% of those into TCM, transition of care management workflow, which is great for the revenue and great for the patient care. Next slide. Some of the lessons learned, one of the big lessons learned for us is digital divide, as we all know that it's real for the community and patients. As Dr. Valenti also mentioned, some of the patients in Texas don't have internet. I think in Massachusetts, we also have patients who may have internet, but they have digital literacy issue where they don't have smartphone, or if they have a smartphone, they don't know how to turn on the camera, let alone log into an app. But one thing we also learned is there is a real digital divide in your care teams. If any of you who are working in a large practice or you have more than 5 providers, you're probably experiencing this also, where some of your providers are really embracing telehealth and some are waiting for this pandemic to end and go back to their previous state, what they consider normal. So digital divide is definitely real for your care teams. The other thing is, whenever we do any rapid deployment, you need to have your team, your leadership, everyone to participate. There are many obstacles, and unless you get all your key stakeholders engaged, many of the lessons learned early on are something we experienced, that Medicare population did not having any vitals became a challenge for a lot of our providers to do the annual wellness visit. And rapidly, as the environment became safe, we started to bring those patients back, because some of the visits are not appropriate for telehealth, at least with the current state of infrastructure we have at home. The other key thing I would like to mention is there is a value in applying an old solution to a new problem. What I mean by that is, as soon as COVID-19 happened, as the volume of in-person appointments reduced, we started to see floods and floods of phone call coming to our call center. And good old medicine with triage, telephonic triage, became really a leverage point for us, where we started to use our nursing triage line and started to find the patients who are appropriate for telehealth through the triage alone. So having a good triage protocol, whether it is telephonic triage, or you enable your nurses by giving them video capability, do a proper comprehensive triage, uh, there is a value of applying an old solution to a new problem. Same thing we also learned is some old problems require new solutions. Chronic conditions being the best example. We were already live with chronic care management program for last 3 years, but we saw a tremendous value of implementing remote patient monitoring program. And after 3 months of vigorous planning and due diligence, we implemented that in October. And we have about 250 to 300 patients right now in that project, where we are giving the devices to the patients at home, collecting those readings almost real time daily. Care teams are looking at it, and we are using telehealth component of video visits or video interactions to manage the chronic conditions more comprehensively. And that is definitely coming to an advantage for us at the Edie discharge follow-up program, which we are launching actively right now too. Some of the future points where we are highlighting our focus for 2021 is we do not know where the industry is heading from the regulatory and a payer standpoint, but there is definitely a healthy mix of telehealth visits and in-person visit, which is needed. Some industry experts say upwards of 15 to 30% of primary care visits can be done via telehealth. And I think natural progression of telehealth at Compass definitely has validated that we have about 15% of our current volume without an active promotion of telehealth is uh, by happening on its own. And currently, as some of you may have heard or not, Massachusetts is reverting back its reopening plan. And as of this Friday, our local hospitals are canceling the elective surgeries. And we as an outpatient facility are also gearing up to improve our telehealth access in next 2 weeks. The other focus beyond the pandemic for us is going to be continuing to put care where the patients are. So all the remote care delivery models, whether it is reaching the patient after ED follow-up via telehealth or giving them devices and monitoring their chronic conditions, or even coordinating with your home health agency or visiting nurses and improving chronic disease management. That would be our focus moving forward, in addition to sustaining in-person comprehensive care model. And lastly, I would suggest that the biggest focus for us is going to be uh, seeing where patients and providers are finding the comfort level in applying innovation on the fly. What I mean by that is patients are being creative themselves. I just had a patient yesterday who not only had the pulse ox, but bought a digital stethoscope and offered me, do you want to listen to my heart sounds? Like people are being creative on the fly. Um, was I able to successfully hear these heart sounds? Not really, because that there are still challenges around the telemedicine platform and trying to get comprehensive examination done, including heart sounds and lung sounds. There are devices available in the marketplace, consumer space, such as TytoCare, which some of you might have heard. But we have a long way to go to really get comprehensive evaluation done at home. Uh, the one thought I would leave you guys with is uh, work with your teams and have ears to the ground with your care teams, and you will see that innovation is already happening. And as a leader, you just need to find those innovative ideas and people who have solved the problems or trying to solve it and cultivate those ideas into comprehensive projects. With that, thank you. And I hand it over to Lisa.
Yes, thank you, Dr. Shah. I actually have a question that came in, and I'll read it out to you. In terms of scaling, since the unique makeup of your organization, size-wise, staff and providers, physicians, can you touch on how did you manage to align all the sites launching together from staff and infrastructure and technology aspects? Thank you.
Yeah, absolutely. I think the way we align that is constant communication on a daily and a weekly basis. When we were going through this implementation, we had providers who said, why is it taking too long for you to do telehealth? Because some of them just started to talk to their colleagues somewhere else who are in a solo practice and started working on Doxy.me and got up and working in 3 days versus it took us 3 weeks. So no matter how fast we did it, 3 weeks was still short for some providers versus others. They were patiently waiting for guidance. I think the way we did it is constant communication. I think Dr. Kozlow, who's our VP of strategy, he did an amazing job spearheading the telehealth coding and compliance. He's our general counsel also. So we were having almost twice a week communication with our providers via GoToMeetings and you know, round robin, just join whoever can for weekly meetings and answer all the questions, made them comfortable that your team is working behind the scenes, just give us some time. And I think once you start getting benefit of doubt from your team and they know you are working on a comprehensive plan, it became successful. And I think there's a saying, well thought out plan done tomorrow is probably not worth. If you can do a vicious plan today, which will work, go for it. So I think that's the mindset in the leadership you need to have, that we just came up with a vicious plan and got it done. We learned a lot. We made a lot of mistakes, but I think people gave us a lot of benefit of doubts in the beginning since we communicated routinely.
Very good. Thank you so much, Dr. Shah. I think we're moving now to Florida. Matt?
Thank you, everyone. I'm introducing Dr. Corey Howard. Dr. Howard is the past president of the Florida Medical Association and chair of the FMA delegation to the American Medical Association. Dr. Howard's also a solo private practice physician in Naples, Florida, specializing in internal medicine, who focuses on finding ways to help each person reach their health goals through lifestyle intervention and careful consideration of each person's needs. Dr. Howard, turning it over to you.
Okay, well, thank you very much. Let's bring up my deck here. All right, fantastic. Thank you, Matt, and thank you, everybody. This was a fantastic experience. And I'm just going to quickly go through a couple of things. We heard some great information, of course, already. And, I'm going to give you a perspective from not in a big group and not in a massive group, but somebody who is in solo practice and, where COVID could decimate the entire practice and how important what we did in this initiative helped. As Matt said, I'm in general internal medicine in solo practice. I do take insurance, although I do also have an extended agreement arm to my practice. I really used it primarily for virtual visits in terms of new patients. I don't do that as much, but during the height of COVID, I was. Follow-ups are great, obviously. This is a great way to connect with patients in discussing labs and things like that. And acute illnesses, it was really pretty limited for me to just a number of specific problems that I saw. This is a picture of my office, of course, which is probably unlike the office seen with probably 500 physicians. But in either event, let's go on to the next slide here. And, this is really my setup. And it's really pretty basic. I don't need much. I use two computers primarily because I dictate, believe it or not, into my EHR. So every single patient has a customized note for me, no matter what they do, even if it's telemedicine. And so the playbook to me was really the most valuable part of this entire process. Once that was created, it really helped me identify how much I really needed it, even though I had been using a telehealth platform for about 2 years prior to COVID, but it was very unsuccessful, cumbersome, clunky, patients hated it. So it just was terrible. But what happened with the playbook is it really allowed me to look at the design of what I wanted to do, take a look at a bunch of different vendors during the process quickly. The Florida Medical Association directly was involved in that with me. Matt and others allowed me to, be one of the people that tried a couple of the different platforms out there. And then, I'm going to talk a little bit about the lessons and my timing for the whole thing and what's next. So now, as far as what my key accomplishments were, really the first part was deciding on a vendor. Now, I have a little bit different need than other people because I didn't need billing and coding. I already had all that. I just needed a way to connect with patients. Now, Naples is a very unique environment. Most people are very healthy. I think it's one of the healthiest places in the country. And so they're very aware of what they want to do. But in terms of telehealth, I needed a way that it would easily upload into my electronic record and something that was easy for the patients. That became a little difficult. Yes, I used Doxy.me, as somebody had mentioned, and yes, I used a couple of other platforms. But quite honestly, I jumped in while having a bunch of alternatives. So if somebody couldn't get on the particular platform I was using, which was I used a simple one, Practice Fusion with UpDocs, I would go to Doxy.me, and if that didn't work, I'd go to FaceTime, and if FaceTime didn't work, I'd do a phone call, and if that didn't work, well, we had trouble. But one way or another, I was able to connect with patients. The key accomplishment for me was really learning how to code for this and really get paid for what I do. It made my time much more valuable because, back in the day, people would call for refills or call for this, or, you want to have a follow-up for a series of labs. I do extensive laboratory testing on people. And this was a way to really maintain communication, directly talking to people about their things. Nobody complained about it. It really helped a lot. And in terms of that, I wound up having great buy-in from my patient population. I did have a few people, 89, 90 plus years old who didn't get on, and we did a phone call, or if I had to see them, I had to see them. That was that. But it really didn't limit care too much for me during the peak of COVID, because I was able to jump into that. Just next. So when I'm looking at this, and the lessons for me probably are similar for everybody. First was, setting up the patients and doing stuff. Now, as a solo practitioner with limited staff, this is all on me, and I happen to be fairly tech savvy, so I enjoyed the process. But at first, we didn't have a virtual waiting room, and I think a virtual waiting room and a very good virtual waiting room, which needs to occur, is a key. For me, I call them. I actually don't call them in advance. I just send them a link right away. They don't have to use a special app or anything. They just literally click on the link on any device, whether it be a phone, Android or iOS platforms, or a Mac or PC, laptops, or any really thing, and they can just connect. They do have to know how to connect their microphone and camera, which sometimes is a problem. So I walk them through it. In fact, I walk them through a lot of stuff. Sometimes I have them bring in their devices, and I actually sit with them for a period of time and teach them how to use it. But in either event, the timing of the visits, I think, was the big thing, because in the beginning, it was kind of whenever. So if I had a patient and then another telehealth patient or two and then somebody else, that was a disaster, because I like to not only run on time, but my patients require a lot of time. So every one of my visits basically is about 30 minutes to an hour. But these allowed me to do a little bit shorter visits for things that weren't as difficult, whether it be filling refills or something like that. Learned how to do the coding, of course. In my system now, I have a notepad, so I can take notes directly in the computer, which I never do when a live patient is in front of me. I'm never on a computer. I always listen to the patient, I have hand notes, and then I work on that. Maybe old fashioned, but it works for me. The important thing is checking audio and visual, like I said, and having some alternatives, which was really the key for me. Next. So my key priorities moving forward now are to advertise it more to my patient population. I don't see 1,000 patients a week. I have a very limited number of patients that I see for general internal medicine, because they all take a bunch of time. But, I need to advertise it more to my patients and look at some additional vendors, see what's new, see what's out there. How can I better evaluate that? Again, I couldn't do that without the playbook. And then increase my numbers even more, whether I'm seeing, if I have a profile of 20 patients in a day and I can do 5 telehealth visits in time that would help them, I would do it, or more. If in the height of COVID, if it turns out that Florida, which hasn't changed their rules at all, then I would convert quickly to another platform. One of the keys, I think, which nobody really mentioned, is that we need to make sure legislation is available, that we get paid for what we do. I have already been contacted by one of our large providers, Blue Cross specifically in Florida, that want to pay 75% of the Medicare rate, and if I don't do it, they'll send it off to one of the large providers, and I think that's a disaster for medicine. I think physicians need to be able to do that, and so that's a key priority for me, is to work on that both at a state and national level. And also, I'm going to consider using it a little bit more when patients, when the office is closed, if I need to, and expand my uses, and we'll talk about that in a second. Next. And that really has to do with remote patient monitoring. This is one area that the initiative really opened up my eyes, because I always have people when they're home on telehealth checking their blood pressure and their weight, but now there's really a way to monetize that, because it does increase patient satisfaction and reduce hospitalizations. I need to learn how to integrate it more into my practice and select a vendor for the devices that integrates directly. I know it exists, and I know there's several different vendors out there. I'm a little bit cost conscious, so I got to do something that fits into my budget and really helps my patient population. But I understand it is a significant source of income for monitoring patients chronically, and I've got plenty of those in terms of things that they need, especially blood pressure, which is a key priority for my practice, and cardiovascular risk assessment and taking care of them. So remote patient monitoring is really something that I'm looking forward to expanding in the future. Next. So in conclusion for me, short and sweet, the telehealth initiative really was fantastic. It allowed me to rapidly put telehealth into practice. Really educated me on the coding part of it, which was absolutely key. And I was happy to see that they offered solutions for individual practices and not just large groups. And so for me to scale it for what I do is a lot easier than the large groups. And it really gave me the confidence to explore other options, such as remote patient monitoring. And overall, I think it's an extremely valuable program, and I think that every physician could benefit from it. Thank you.
Okay, thank you, Dr. Howard. First thing we've had somebody ask if you could speak a little bit more about the dictation software you use and your experience with that.
I think it's great. I actually use Dragon medical version, and every year or two I do the upgrade. I use it on a PC because on a Mac it's awful and stopped being supported. But on a PC, on a good solid PC platform, and now it's online, by the way, through Dragon, what's called Dragon 1. But I basically am in my note, and I basically just dictate as if you were reading a real note. So it's not point and click. I do have macros that I have self-created, and I call them by various names, LM1, PC1, whatever it is. I have a little code, and then it populates things that I say regularly, like we all do. I mean, we all repeat ourselves a million times a day. And so since I do like to talk a lot, I like to give the patients the information. So all of that information winds up going in their care plan. So by customizing it for each patient, they really enjoy being able to read, what I wrote, and it helps them in their care overall. So I would say it's a highly successful platform for me.
I'd just like to jump in and say we use the same one, Dragon 1, and it has been a game changer for us. Between that and the templates, I mean, you really can spend more time with the patient and less time taking down notes. It's really been fantastic.
And also, Joe, the big thing with that is that it customizes your notes. Is when somebody reads it, other than just a patient, they actually read something that's valuable. Not just the gobbledygook that you get from some of the systems, and I'm not being critical with anyone specifically, but just customizing even a few lines can help another physician, especially a consultant, understand why they're doing what they're doing, or the direction to go. And I think it's valuable for us, even in this environment.
I agree. We're even able to dictate in to populate scripts and diagnoses codes and CPTs and everything, and it picks it all up easily. So
that's fantastic.
Much better than it used to be.
Right. ECW is a good platform. It's pretty robust. They started off really well. They had funky buttons in the beginning, but they evolved into something that's really user friendly, I think, as far as other systems go. I don't use it now because I don't have that kind of robust need, but I think it's a really good system, and I'm glad to hear that it does that.
Agreed.
All right, thank you, Dr. Howard. I'm going to pass it back over to our to Dr. Libby here, so he can introduce
All right.
Dr. Bailey.
Thank you very much. Have a good night.
Hey there. It's really amazing to hear your presentations. I'm really, really super impressed by the work you guys have done and how well you have represented it in these presentations to us. It is really fantastic. Thank you. And I really look forward to seeing how we move forward with this, because this is a dynamic dimension of practice, and it really can create some great opportunities for us. Okay, we're exceptionally honored to have one of the genuinely great physician leaders in healthcare to share a few words with us. Dr. Sue Bailey is a pediatric allergist in private practice in Fort Worth, but is best known to us at the AMA as our former Speaker of the House and now our president. She understands the importance of telehealth and that physicians need to lead its evolution and integration into practice. And it's with great pleasure that I introduce Dr. Bailey.
Thank you. What a nice introduction, and good evening, everyone. Dr. Kreidel, who was going to be here, sends his regrets. He had an unavoidable conflict at the relatively last minute, but I'm happy to be here, and I've really enjoyed this this evening, and have been talking about y'all in speeches that I've given all year long. So it's wonderful to hear about it. I really think we need to take time to celebrate the incredible work that all of you have accomplished. Thanks to the Physicians Foundation, the TMA, FMA, MMS. You know, talk about being in the right place at the right time. What was initially planned to be a paced implementation program specifically designed for early adopters, obviously was dramatically expedited due to the unanticipated needs of COVID-19. So within a few weeks, practices like yours and mine went from doing zero telehealth to nearly 90 to 100% of patients virtually, which is just absolutely incredible. Listening to the practice spotlights featured today, it's clear, obviously, that this transition has not come without challenges. Physicians and care teams need to rapidly select a telehealth technology vendor, design virtual workflows, manage patient communications, stay appraised on reimbursement and regulatory changes, you know, frankly, completely rethink how we've traditionally delivered healthcare. So in addition to continuing to see patients outside of the practice, we've come together to advocate on important telehealth related issues critical to ensuring increased access to care is available throughout the pandemic and beyond. You know, during this emergency period, we've sought and secured broad telehealth expansion by increasing coverage and payment at the federal and state levels to increase access to care. We've gotten changes to federal policy rules to allow physicians to see patients in their own homes via telehealth. We've gotten HIPAA enforcement discretion, allowing physicians and patients to use a broader array of platforms to deliver telehealth services. And we've secured the introduction of legislation to make key telehealth policy changes permanent post-pandemic. Now, while our work and commitment to expanding telehealth is not done, I think it's important to pause and recognize the great deal of accomplishments that you've achieved this year. In the face of unprecedented challenges, you all have risen to the occasion, demonstrating an unwavering commitment to providing high quality care. So on behalf of the AMA, the Physicians Foundation, and all of the participating state medical societies, we want to say thank you. Thank you for all that you've done and will continue to do. It's been our privilege to stand beside you. Thanks.
Thank you, Dr. Bailey. It is such a pleasure to have you. We really appreciate you being here with us tonight. I'm also, I think, speak on behalf of everyone involved that we're really grateful that you continue to elevate the great work that these practices are doing, and that the organizations, the Physicians Foundation, the state associations are doing to really support practices across the country and implementing telehealth, and look forward to continuing to share, what's to come of this as we move forward, and always welcome, any feedback or specific areas that you would like to see us focus on as we move forward and continue to collaborate as a group. So again, thank you so much. It is such a pleasure to have you here. And I'm also really excited that you got to hear from some of the practices participating, because it was not only awesome for, I think, myself and the others that have been kind of leading a lot of the work here, but I love seeing the collaboration and the opportunity for practices across the country to engage with each other and learn from each other. And I think that's been kind of again, to your point, a very serendipitous timing, where I think we had a planned program and life happens, and it was a real good opportunity for us to grow and learn from each other as we moved forward along the last 8 or 9 months or so. So thank you again. Also want to say thank you to Dr. Valenti, Dr. Shaw, Dr. Howard for sharing what you've learned, what you're planning to do in the future. Can't wait to see what comes of that, and additionally how we can continue to support you in those endeavors. And not sure if we planned this, but I think we had a really great diverse set of practice types and sizes. We had a specialty, we had a small practice, we had a large practice. So I think that just speaks to the work of this initiative and what we've really been able to put together as a group. So it's really exciting to see what's next. So with that kind of leads me into what's next. While we may be formally sunsetting the expectations for the practices around this work, we're really excited to continue engagement and collaboration with the Physicians Foundation, the state medical associations, and the AMA. And I think what we're most excited about is, potentially really the expansion to more practices and more physicians that get to engage with this content. I think this was a mini kind of contained pilot, and we're really looking forward to expanding the programming to really create additional reach to help support more practices and more physicians across the country. I did want to share that in our professional satisfaction and practice sustainability area of the AMA, we've been really focused on creating a new webinar series. So, kicking off very early in 2021, we will be doing a little bit of a review webinar on telehealth trends informing the future of virtual care. So looking at a lot of the research that has been done over the course of the last 8 to 9 months, and really looking at how we can optimize and continue to improve virtual care and telehealth for both the physicians and patients. And then the second week of January, we will be having a webinar focused on telehealth policy and coverage. We'll have some of our advocacy colleagues at the AMA be kind of giving you the latest on what is to come of telehealth policy and coverage in 2021, really focused on the 2021 physician fee schedule and the changes that come along with that, and really kind of just doing a refresh so everyone knows what to expect throughout the course of 2021. We also can share some past webinars that we've done on telehealth and team-based care. I think you heard from Dr. Valenti and the others as well that it's really important to think about how you can incorporate your care team into these visits to help support you in providing these visits and encounters to patients. And then additionally, we have some future topics planned around the research findings around the return on health, and really kind of understanding how to evaluate success and what those success measures can look like across different practice sizes, payment models. We'll look at integrating different, I like to think of it as almost like the third party. How do you incorporate the third party into a telehealth encounter or visit? That may be a medical student or a resident. If you're a physician that is in a teaching environment, That may be a caregiver that is across the country and wants to participate in a visit. That may be language services and an interpreter that can help support that visit. So really thinking about how we ensure that, that interaction is as productive and helpful and useful to both the physician and the patient as it can be. And then additionally, I think we're really going to start to try to focus on developing content around how to support physicians in telehealth and how to do that from a clinical perspective and evaluate some case studies of how do we really facilitate that visit for this specific condition or this specific patient population and make that really successful from a clinical perspective. So a lot coming down the pike. That of course includes remote patient monitoring too. It seems like that's definitely a popular next step for integration as many of you move forward in expanding your virtual care offerings. So we will continue not only from an AMA perspective, but in collaboration with the Physicians Foundation and the state medical associations in delivering that content and supporting not only the practices that have participated with us through TTI, but also many other practices and physicians across the country. Really quick, one last housekeeping item. If you are claiming CME for this session, here is the link, but you will also be redirected after this webinar closes to take the evaluation, brief evaluation right after this, and then be able to claim directly from there. So hopefully that streamlines that process a bit. And then, really just a final thank you from myself, and I'm gonna, open it up to my colleagues at the state associations as well as Dr. Libby from the Physicians Foundation. While we didn't have the opportunity for this program to run exactly as we had originally planned, we're super grateful for your continued engagement. The timing of this really did end up being crucial and a great way to bring groups together to learn. But, the learnings and experiences that each of you have shared with us along the way have been so crucial to our advocacy efforts over the last 8 months. And, I can't tell you the number of times that we've been, reached out to from our colleagues at the AMA advocacy team that we're looking for just your experiences and sharing, the use cases and the patient perspectives that you were hearing, really to kind of augment, amplify those voices, on the Hill with, Health and Human Services, CMS. So it has been invaluable as we move forward. And I really definitely look forward to physicians, continuing to lead the way and ensuring that both physicians and patients have access to telehealth as a way to both deliver and receive care respectively. So again, thank you so much. I definitely look forward to continuing to engage with this group. And I'm going to open it up either for questions and or Shannon, Matt, Bisan, Dr. Libby, welcome your thoughts as well. And a thank you to you guys for being great teammates and co-collaborators on these efforts with the telehealth initiative.
Thank you, Stacy. I just want to say, echo great collaboration, and just know that even though the formal project is ending, we are ready and committed to helping you in whatever way you need as you continue. So please reach out anytime.
Yes, ditto, and we're grateful for this, the great work from the AMA, from all the association, definitely from Physician Foundations and this great team and all the practices here in Massachusetts and all around and deep inside. I mean, we all just become this virtual family, I will say. I wish we were in Texas now, but it did not work out the way we want it to be. We're very, very grateful for all the work, very humbling, everything you guys have done and shared. And I always say, if we can have 3 different states with completely different setting all work together, we can all work together. So it's grateful. Thank you so much. Have a great night.
We would just copy those comments down here in Florida, and it's been great working with everybody. As you said, very unexpected year, but happy to keep going on an informal basis with everyone. So everyone have a great night, and talk to you later.
And it's Dr. Libby. I'm just so grateful to the AMA for doing what they did to provide us with great staff. Stacy, you and the whole group of people working there in the division really supported us in a phenomenal way. and really created the opportunity for us to generate the actual expertise and get it out to doctors, get it out to the state medical organizations. And that has been such a great effort that has been so collaborative between all of these organizations working together with you to give you those insights and to allow us to have these doctors participate in a real evolution of a new way of delivering care that has so many dynamic opportunities from here. I'm just really gratified, really happy, and hope that we can continue this good work. Thank you.
Thanks, Dr. Libby. Well, if that is good with everyone, I think we'll call it a wrap and let everyone go this evening. Thank you again, and I am confident that we will continue to be in touch. And you know, of course, any questions, feel free to reach out to any of us, and we'll be happy to connect and continue to work together.
Thank you. Well done, everyone.
Thank you. Good night.
Good night.
Good night.